Hey, beautiful people, very beautiful morning, beautiful afternoon, and beautiful evening to every one of you. How are we all doing? I know we're doing amazing, all right. So, in today's video, I will be teaching you 10 top tips at recent or at present that you should be aware of. But before we dive into this video, I like to give a massive shout out to those who have passed their Osces. I am super excited for you all, and if you're writing soon, oh my god, you're definitely passing. Just make sure you keep practicing with your peers, practice with your colleagues, and by the grace of God, you will definitely be successful. All right, guys, so I've done a couple of videos. I've done fall and fracture. I've done A to E assessment of an homeless patient. I've done suppository. I've done nutrition assessment. So, but these videos are exclusively for channel members. So do well to click on the join button so that you can have access to these exclusive videos. Without wasting time, let us dive directly into today's video. Come on, guys.
Ryan Little.
All right, guys, welcome back to my channel, and let us dive directly into 10 important tips you should be aware recently in your OSCE exam. Number one, the sites for taking temperature is not the temporal region for your OSCE exam. Yes, it is not the temporal region. They're complaining about that seriously. It is the forehead. So please, I beg you, take the temperature or the patient's temperature in the forehead. Tick. Number two, a lot of students have been failing peak flow meter. In my opinion, peak flow meter is the easiest skills. But why are people failing it? Now look at number 5 points in your marking criteria for the peak flow meter. I have it here. Permit me to read it from my phone. Number 5 point says insert a disposable mouthpiece into the peak flow meter or use a single use reusable peak flow meter. So the main heading now is insert a disposable mouthpiece into the peak flow meter. And most people on their exam day, what do? They do not insert any disposable mouthpiece. A lot. When I say a lot, I'm not joking. Like, guys, I'm even overwhelmed. So even open my email, I'm so scared because of too many messages. A lot of people have asked me, Vale, please help me with class. I've not been able to. It's only those that have received that have been trying to help out because I know them, they are more delicate now at the moment. You get? So please use a mouthpiece. So on your own skill exam day, you will see the peak flow meter and you will see the disposable mouthpiece. Insert the disposable mouthpiece. It's so easy. Just insert it to the peak flow meter. That's all. So if you don't insert that disposable mouthpiece to the peak flow meter, you're going to fail. It's part of the marking criteria. When you are performing any skill or stations, that's also is with the marking criteria. Ticking and ticking, but you don't use a disposable mouthpiece, which is part of the marking criteria, so of course it's going to be a fail. You get? That's number two. So please, if you happen to have peak flow meter, read your marking criteria when you are watching videos. I've always said that please insert the disposable mouthpiece into the end of the peak flow meter. Tick. Number three, subcutaneous injection. Now, guys, as simple as subcutaneous injection, what do you get for subcutaneous injection? Usually insulin. As simple as it is, remember, if you don't clean the vial, for you to administer any injection, you have to clean the vial of the injection now. You have to clean it out, the vial of the injection. You have to clean. So if you don't clean the vial of the injection, it's going to be a fail. It's part of the marking criteria that clean the vial of the injection. Yes, the top of the vial of the injection you are to administer is to be cleaned with clean air. You clean it with clean air wipe for 30 seconds and you're allowed to dry for 30 seconds before withdrawing. Yes. Now, before you administer subcutaneous injection on the patient's skin, you have to verbalize that the patient's skin is clean and so you don't need to clean it anymore. So if you don't clean the top of the vial of the injection you want to administer, it's a fail. The hand, if you don't verbalize that it's clean, he's also a fail. So these are the little things people are failing in the OSCE exam that are easy. So that is why I am bringing it to your notice. Now you must also assess the injection site. You want to give a subcutaneous injection or you want to give an IM injection. You must assess the injection site. There is no inflammation. There is no redness. You are happy to administer. You must assess the injection site. For subcutaneous injection, you can verbalize that the skin is clean, you don't need to clean. But for IM injection, you must clean. You must clean with clean air wipe, allow to dry for 30 seconds, and you must assess the injection size even before cleaning. Tick. Now, another thing is removal of catheter. Removal of catheter. Now, a lot of people go there to remove catheter and they just greet the patient. I'm here to remove your catheter. Is this a convenient time? And the patient says, yes, it's the convenient time. You do your hand hygiene, you go, you assemble your equipment. When you come, you don't verbalize that the genital area is clean. You just begin to remove. No, you must verbalize that the genital area is clean. So because it is clean, you don't need to clean again. So all you need to do is to tell the patient, are you ready for me to remove your catheter? The patient says yes. I'm going to remove 10 ml of sterile water, which was used to secure the catheter in position. Now breathe in and out for me while I take off your catheter. It says after you take off the catheter that you will clean. But if you do not verbalize that the genital area is clean and so you don't need to clean, they'll fail you. Yes, it's part of the marking criteria. So these are the little things. And that's why a lot of people are feeling like the exam is hard. No, it's not hard. And that is why I am bringing them to your notice. Another thing for fine bore NG tube. Another very simple skill. We all know that you have to place a receiver at the end. This is the patient nurseries. You are inserting, you have to place a receiver at the end. We all know that you have to let the patient know that if they want you to stop, they should raise their hand. You have to let them know of the signs of distress when you are inserting the NGT, which is coughing, breathlessness, and you let them know oxygen and suctioning machine is available. The assessor wants to hear this. The exam is such in a way that you must get 100 over 100. That's the problem. And it's simple. You will get it. That's why I'm bringing tips like this to your notice. At least if you hear this, you will not make mistakes. You remember that, oh, I have to marry my marking criteria as much as possible. Yes, for your evidence-based and professional values, I've done almost all. And I've always said that you don't need to use the same words they use, but it has to have the same meaning. Meaning that you can use your own words, but it has to have the same meaning. Now, planning. This is where I want to talk about. If you have a pre-op patient in your assessment, when you get to planning, please read your planning. A lot of people will have pre-op patients in their planning. When we have pre-op patients in their assessment, when they get to planning, they just fire down without reading the planning. And they start planning for pre-op. Meanwhile, the planning, they've said, candidates, please plan for post-op. Patient is now back from the theater. Please plan for post-op and plan to post-operative care plan. But because you have already assumed that because you have a 2-year assessment of a pre-op patient, then your planning is going to be a pre-op patient. No, it doesn't go like that. So please read your planning. I've had this several emails. Not let I fail my planning. Okay, what did you have in a 2-year assessment pre-op? What did you plan for pre-op? Did you read your planning? I'm not sure. Probably they wanted you to plan for post-op. Yes. A lot of times they want you to plan for post-op when you have a pre-op patient in assessment. So you must read your planning. Now, another one I like to talk about before I cap it up, I don't want this video to be too long, is those who are having fall and fracture scenarios. I saw some arguments in the comments, but I wasn't able to respond. Guys, if you have fall and fracture, and the patient has fractured their right neck femur, and they verbalize that the patient should not be mobilized, you get. Now, you want to plan. You finish planning for pain. You want to plan. Now, you're planning for weeks for fall. And in your fall and fracture scenario, they said patient should not be mobilized because the patient has fractured a right neck femur. Do you get? So because they said patient should not be mobilized, even if you want to plan for weeks for fall, you can plan. But then your aim of care should be patients will not have any incidents of fall. Not that you are planning weeks for fall and you are saying aim of care, mobilize patients independently or with assistance. No, that is wrong because they have said it that patients should not be allowed to mobilize. So your aim of care there should be patients will not have any incident of fall. Besides, there are a lot of care plans for fall and fracture. Pain is there. Risks for impaired skin integrity is there, especially in fall and fracture cases where they've said patients should not be allowed to mobilize. risk for infection is there because a lot of times they will tell you patient has fractured their right neck femur and they are telling you that you should not mobilize patients, and at the same time they are telling you that patient is for internal fixation surgery. So there's risks for infection. Yes, most times if you're doing your assessment, the patient has low temperature, hypothermia. You plan for patient is having low temperature, hypothermia. There are a lot of things to plan for. It just boils down to your scenario. So please look at your scenario very well. Okay? All right, guys, I hope you've been able to learn one or two things. If you have been asking me, Nurse Violet, do a video on afema disease, I have done that already. I'm just trying to edit it. If you're asking me to do a video on oral care, I am currently working on it. So don't worry. I've done a couple of videos as you can see on the screen, but those ones I uploaded them for channel members only. So click on the join button to be a channel member and get access to those exclusive videos. Thank you for your time. I love you. Bye.